Why is court guidance used for lung cancer biopsies? Imagine trying to find a tiny needle in a haystack. That's similar to how doctors locate small lung nodules or suspicious masses inside the chest. Using computed tomography, or CORT, guidance makes this process much more precise. CORT scans provide detailed, cross-sectional images of the lungs in real time, allowing doctors to see exactly where the abnormal tissue is located. This helps them guide a thin needle directly into the lesion, ensuring they collect tissue from the right spot. This accuracy is crucial because it improves the chances of correctly diagnosing lung cancer and determining how advanced it might be. One of the main reasons CORT guidance is preferred is its high diagnostic accuracy. Studies show that CORT-guided biopsies have a sensitivity and specificity often above 90%, meaning they are very reliable at detecting cancerous tissue and distinguishing it from benign or non-cancerous lesions. This reliability helps doctors make confident decisions about diagnosis and treatment plans. Compared to more invasive procedures like surgical biopsies, CORT-guided needle biopsies are safer and less stressful for patients. They involve inserting a needle through the chest while under imaging guidance, which reduces risks such as major bleeding or collapsing a lung. Because the procedure is minimally invasive, recovery time is shorter, and complications are less common. Another advantage of CORT guidance is its ability to visualize the lung and surrounding structures in real time. This means the radiologist can see the needle's path as it moves toward the lesion, making adjustments if needed. It also helps avoid critical structures like blood vessels or the heart, reducing the chance of complications. Lung movement caused by breathing can be a challenge, but with CORT imaging, the radiologist can time the needle insertion or adjust the approach to account for this movement. CORT guidance is especially helpful when dealing with small or hard-to-reach lesions. Nodules less than 1 centimeter, or those tucked into difficult areas of the lung, can be tricky to biopsy. Advanced CORT techniques, such as cone beam CORT with virtual navigation, further improve accuracy and can even reduce the amount of radiation exposure during the procedure. This makes it possible to sample tiny or tricky lesions that might otherwise be missed. Sometimes, combining different biopsy techniques under CORT guidance can improve diagnostic results. For example, using both core needle biopsy and aspiration biopsy can help identify both malignant and benign conditions, including infections that can mimic cancer. This comprehensive approach ensures the tissue sample is as representative as possible. Cost and efficiency are also important. CORT-guided biopsies are quick procedures that can be performed on an outpatient basis, often within an hour. They are more affordable than surgical options and allow for faster diagnosis. Early and accurate detection of lung cancer is essential because it can be aggressive and progress quickly, so getting a diagnosis promptly can make a big difference in treatment outcomes. Finally, without imaging guidance, there's a higher chance of sampling the wrong tissue, which can lead to false negatives or inconclusive results. CORT guidance confirms that the needle is within the lesion before tissue is collected, reducing this risk significantly. This precision helps ensure that the diagnosis is accurate and that patients receive the appropriate treatment as soon as possible. In summary, CORT guidance is a vital tool in lung cancer diagnosis because it makes biopsies safer, more accurate, and more efficient. It allows doctors to target even the smallest or most difficult lesions with confidence, leading to earlier detection and better chances for successful treatment. If you or someone you know is facing a lung biopsy, always consult with healthcare professionals to understand the best approach for your specific situation.